Hello, I'm Stephanie Frisch, Director of Nursing at Vital, where we make AI-powered patient experience software. Today, I have the pleasure of speaking with Dr. Ameer Mody, Associate Director of the Division of Emergency and Transportation Medicine at Children's Hospital of Los Angeles. Welcome, Dr. Mody.
Thank you.
It's a pleasure to
Excited to be
have you.
here.
Thank you so much. Thank you so much for joining us. So, Dr. Marty, I have to ask. I know with all of your experience in pediatric emergency medicine that we have experienced, even in our lifetime, just kind of this evolution of how patient experience has become an integrated part of care and everything that we do, and everything that our patients and their parents expect just at baseline for, excellent care. How do you think that this has evolved over time?
Yeah, I mean, I think that that evolution of patient and family kind of expectations, in a sense, it's been somewhat of a double-edged sword. And I think that we had tended to sometimes confuse like quantity of care with quality of care, and but I think that that the pendulum with that I think is swinging back towards a focus on quality, and our understanding of what quality care means and what our patients and families understanding of quality care means. And sometimes I think things can get confused. Again, I think we need to do work in clarifying that sometimes you may not, the quantity of care that you receive is not necessarily related to the quality of care that you receive. But that needs to be communicated, right? And the tools that we use to communicate is another area where I think can leverage uh, technology. Making sure again that the parents and patients, parents and families understood what happened to them during their medical journey, right? And then being able to um, again kind of be empowered to recognize that not everyone needs labs for you to make the diagnosis for them. Not everyone needs an X-ray. That clinical expertise, as long as it's backed up by a forged therapeutic alliance with the family, I think is something that's important. But again, the expectation of patients and families, I think, is ultimately something that is driving us towards better care.
Do you think that having that technology potentially like in your hand on your iPhone has influenced that at all?
Absolutely, right? I mean, everyone knows about Dr. Google, and uh,
Absolutely. They go to Dr. Google to ask for help.
yeah, they do. But I think what the again, when we talk about like the pendulum swinging, right? I think that the amount of people who understand that Dr. Google has its limitations, and that we have these tools now to also let patients kind of see and do research, and you know what I mean, and see the way that we think. When they're able to read their medical records, when they're able to see their labs, and or their X-ray reports. I think that again, it um, it's patients and families have a higher expectation of what they uh, are going to receive during a visit, but then also I think have the ability to have more informed care as well. And so, um, yeah, Dr. Google did not graduate from my medical school class.
Yeah, I know. It's very interesting sometimes when Dr. Google comes into play and how to navigate that
Right.
conversation with patients.
I wish that we all do a better job of recognizing like the magical place that an emergency department is, right? Is that we sit at the crux of healthcare. And if there's a problem in our society and wherever, the emergency department plays a role in it, right? And so um and I think that and I guess it's a little bit of self-promotion, but if I think if our communities realize how many different places that we impact, and where we sit. So if you talk about any problem, whether it's homelessness, whether it's disparities in healthcare, mental health, gun violence, right? The emergency department sits in every single one of those things. Access to care, uninsured. We sit in all of those things. And when all those things funnel down and they all end up in the same place, you can understand why we can be, we're a little bit busy and we're a little bit, and so, that is macro communication. And, you know, we have to balance that with the right micro communication, also realizing that for most patients and families, their emergency department visit is one that they're going to remember forever, right? Not necessarily it's I still remember
Not in
when
a
my
good way.
parents, right? Not in a good way, right? It's going to be a core
Yeah.
memory, not a core positive memory necessarily, but the burden and the honor that we share with those patients and families, and being able to hopefully have a positive impact on that core memory day that they're going to experience.
Can you tell me a little bit about what steps your team has taken to ensure parents, caregivers, and the patients obviously feel like they're being heard or reassuring them?
So, the things that we have done historically are really focused on, particularly work coming from a children's hospital emergency department, are focused on staff, right? And so, being at a pediatric ER, from the physicians that are seeing you, those are board certified, specialty trained pediatric emergency physicians, right? Who go through extensive training. The nurses are specialists in pediatric emergency specifically. And our techs are the way that we design our hospital has been towards that sense of comforting a child and their family when they're in distress. We have child life specialists, people who are some of my favorite people in the universe, right, who dedicate their lives to helping children and their parents through some of the most stressful times in their lives. Social workers, the staff, the respiratory therapists. We have an extensive staff that's trained specifically on pediatric emergencies, and what they do. Part of what they do is making children feel comfortable, putting them in an environment so that we can do accurate assessments, and then also making parents feel comfortable as well. And so the difference with pediatric, and I'm stating the obvious, is that with pediatric medicine is that you basically have two patients, right? You have a parent and their child, right? And there's situations where they're both anxious. There's situations where just one of them is anxious, and trying to navigate that. Our focus historically has been on having the best trained staff. The newer work is going to be in some of the tools of technology that we can use to help them, right? And so our child life specialists use things like iPads, things like that, distraction techniques. We've looked at how we light the rooms, and how we lay out our rooms to make sure that they're done in the most child friendly way possible. And so there's, I think, a lot of work still to be done in doing those things to allow us to both efficiently and effectively do our work.
What additional things are you doing to kind of increase transparency for what we're doing as professionals, as medical professionals, and then making sure that the patients, and like you said, and their parents, caregivers, whoever's with them on that particular day, to make them feel informed?
This is, I think, where there's so much, I think, wonderful work and so much potential to be done. The understanding of what I like to call a therapeutic alliance that we form
Mm-hmm.
with patients and parents. I think that the historic model of almost hierarchical, where there's a doctor and the patient, and the relationship was one way, right? Meaning that you're the giver of the care, the other person is the receiver of the care. There's time for questions and things like that, but the and I think that was our history, but that's just not what medicine is today. Do you know what I mean? And I think that the work with transparency, so patients having access to their medical record, patients having access to their labs, to those things that empower patients to actually be more participatory in their care, right? And so things like work that we've been doing with patient portal, and letting patients actually see their clinical notes, I think is just a wonderful accountability tool. Do you mean as to what we put into in what we document in our patients? They can that they can see it, and also I think it helps empower them in their own health. And so being able to see your labs and pull them up, and not just be on the receiving end of it, not having to go through 52 different steps of asking for your medical records, they're not your own. Uh, I think are things that help with health literacy, that help with communication, that actually also let patients and families participate in their care, right? And so I think also gone are the days of single patient, single doctor, right? Is that it's rare when you go see your doctor that you are going to see the same person time and time again, right? It's going to be a team that's going to be taking care of you. That's
Yep.
particularly true in emergency medicine, right? I often will tell families, they're like, oh, if we have a really good interaction, they're like, I'm going to see you again. I'm like, if you're lucky, you will never see me again in your life.
It's been a
But
good day.
yeah, but allowing families to have control of their information and their data, so that they can actually you know trend when they see a different provider, they can say, hey, these are what my labs were before, these are my chronic medical problems. I think that level of transparency, I mean, comes with a lot of lift and concerns about privacy and things like that. But when it's done right, when patients have a role in the ability to kind of see what's going on in their care, to peek behind the curtain a little bit,
Yep.
I think ideally forms or forges that therapeutic alliance a lot stronger.
Yeah, absolutely. I agree with you. Are you using technology to keep patients and loved ones up to date on specifically their emergency department journey?
Right now, I think it's true in healthcare in general, is we kind of lag behind, a lot of other industries for a variety of reasons, but we do tend to lag behind other industries with regards to how they use technology and how they might kind of reform or improve processes. Um, a lot of what we're doing with technology is behind the scenes. So, using data. One of the things that I love about emergency medicine specifically is that I think of the fields of medicine, it's the most like a factory. You know what I mean? Meaning that when you look at processes and throughput and things like that, there's a lot more predictability in that model than you think. I mean, everyone talks about emergency medicine. You never know what's going to come in the next day. Yes, that is true, but the patient journey tends to be fairly typical. I mean, it tends to follow a certain number of steps. And so a lot of the work that we have done so far has been on, um, looking at data with regards to those throughput steps, and modernizing them, using timestamp data to improve our processes. Um, the next steps are going to be getting patients a little bit more informed about of those things. And so that is work that we specifically at Children's Hospital are embarking on.
So let me ask you this. Do you think there's benefit in potentially automating redundant potential questions that we get asked a lot in the emergency medicine field, we know, and that we know that are going to come, just to let that patient know about the next steps and expectations within the emergency medicine world?
Yeah, well, I mean, I think without a doubt, there is a huge role for that automation. And what you're hitting on is really important, right? Is that families oftentimes, particularly in pediatric emergency medicine, right, come in in a higher state of anxiety, right? But then once they hear from someone that or they have got to spend a little bit of time, or their pain has been addressed, or their fever's been addressed, right? And then also when their child gets accustomed to their environment, right, and comes from being scared to all of a sudden, maybe reading a little bit, or playing a little bit, or on a device or something like that. Once the anxiety level drops, right, then the expectation of, like, well, what are we going to do next, and what's the next step, and how long is it going to take, are very common questions, and very understandable from the perspective of a parent, and actually from the perspective of the team as well. We all want to know what the next step is and how long it's going to take, and so um, I think there's a huge role for automation, for even building in scripts, for laying out the path for people, and to the earlier point, being transparent about these are the steps that you're going to go through in an emergency department journey, right? And then being clear to families, or at least a little bit more clear to them about, what sometimes some of the roadblocks are, right? And so, you know, uh, we know about the national problem of ED boarding, right? ED boarding is patients waiting to be admitted, and sometimes it can be hours. Sometimes there's places where it's more than a day, right? Those are huge and multifactorial problems, of which the emergency department plays almost no role in, right? We're completely passive to the problem of ED boarding, because you're waiting for an inpatient bed. But patients and families, uh, it's not on them, but it can be a significant source of anxiety, stress, and frustration, right? But being able to communicate to them that this is the next step. This, and maybe even being clear about, your ED team has done everything that they can. They've done their work. We're just waiting for someone else for the next step. Might help allay some of the frustration that families feel, the frustration that is taken out on our staff, right? Is meaning that which I think can affects our staff's level of job satisfaction, their wellness, the rates of burnout. And so again, I think that transparency can be empowering, and then automating those steps in communication, so that when a patient finally you get to ask a question, the question is not what's my next step. It's we've already covered that, right? Is that we can focus on the medicine as opposed to focusing on the minutes.
Exactly. Really just taking kind of honest, like you said, taking emergency medicine to that next level. And then instead of it being a what's next conversation, it's an empowering conversation with patients to really get them engaged in their care and have that open communication that we all, I mean, I know I do. You probably do too. It's like you crave that interaction to make sure that that patient is getting their needs met in a timely manner at the right time. What do you think we should adopt in healthcare? Like, are there certain things that we should be adopting? And then what impact do you think that these technologies can have on patient outcomes?
The big answer is probably has a lot to do with some of the work that's being done with AI and large language models. Utilizing some of those things in a safe and effective way to really reduce the amount of time that providers have to doing some of the non-clinical work that they do, and focus on the clinical, right? And so one of the biggest drains, I think, for nurses and for physicians and Ps in practice, is the amount of time they take documenting, right? Whether it's documenting in the EMR, or doing kind of redundant work with regards to referrals and paperwork and prescriptions, and a lot of those tasks can be, I think, addressed utilizing AI technology. So, like one of my, I think, an exciting new field is going to be using AI for scribes, right? And so scribes started, probably maybe 15, 20 years ago. And, some of the places where the scribing kind of process was innovated was emergency medicine. I mean, just side note, one of the things I love about emergency medicine is our ability to grow, adapt. You know what I mean? A lot of the emergency department is really all of healthcare in a little crucible, and it's its own little health system. And so it's a great lab for for research. It's a great lab for development, for for testing ideas, for piloting ideas. And so scribing is one of those things. And I think that utilizing, having a room that's set up where you don't even have to have the room can be set up itself for as kind of a scribe, where it listens to your interaction with the patient and their family, right? And then when you leave the room, right, you have part of your documentation or most of your documentation done. And when you're telling a patient, when you're educating them about something, when you're talking to them about their prescriptions, those things can happen at the back end. Um, and I don't think that it's a huge technological leap. Um, for an AI, large language model kind of guided system, to be able to do that, and to reduce the amount of time that providers spend typing that stuff out, and letting them spend their time doing what they love doing. When I'm
Exactly.
having a conversation with a family about a fever, there's a lot of details in there that are not really, that are extraneous to what, to what needs to be put into the EHR. And so training an AI to be able to pull out, to pull out the signal from all that noise,
Hmm.
I think is going to be, is a huge area of potential. And it's one of those things that lifts all the boats, right? So
Hmm.
it will improve, I think, the patient experience, because I think half providers will be on a computer while they're talking with patients.
Yeah.
Half of us don't, and interact with the EHR outside of the room. But
Right.
we know for a fact, patients and families crave that face-to-face eye contact, right? We do a better
They
job
do.
of
What?
communicating, of receiving information, right?
Yep.
Um, and then, so if it improves patient care, if it improves efficiency, if I'm able to see, a couple of extra patients because I'm not spending
Right.
my time, and then if I'm able to go home at the end of my shift with all my charting done, right, it actually impacts
Right.
patients, it impacts process, and it impacts providers in a positive way. And so, uh, exciting stuff.
It is exciting stuff. I see it helping patients as well on their side, because I potentially could see something along the lines of, if we are able to record and capture that conversation we're having, right? And I think maybe, like you said, there people are a little anxious. Their caregivers are anxious. If we could take those large language models and generative AI and actually made it succinct and actually gave them key bullet points of everything we just talked to
Hmm.
you about, because I don't know about you, patients don't remember a lot of things we tell them, and it's not their fault, right? It's the, I'm not at the phase right now in this situation, things have been relieved yet, I'm not really listening to you, I'm not in the phase where I can learn, right?
Right.
So just having it more as just a notebook, it literally is taking notes for you, and then you're able to reference that notebook later.
No, I think another huge area, right, in the area, particularly in emergency medicine, of both patient education or aftercare, and one that again I think meets patients where they are.
Exactly.
We, when someone is discharged right now from the hospital, they get a huge stack of stuff. Right, anywhere between 5 and 15, 20 sheets of paper, right?
It might
And
be
sometimes
called
they'll bring them
the
from one
discharge
ED to,
summary.
right. They'll bring them
It's a
from,
discharge novel.
yeah, and it's full of a lot of noise, and something that's not important to families. And so, if someone comes, what you're saying is so true. So if someone comes in with their child with a broken arm, right? Obviously, a lot of worry, a lot of stress, and then then things are better. But there is pain control afterwards, what to look out for, cast care, how to take a shower. Do you know what I mean, when to see ortho, and all those pieces that we hand to them in a book, right? And um, if we're able to create, either through their portal or either through a chat bot, you know what I mean, something that allows them to get there, to when they get home, when they're in a more receptive place to receive some of that information, or when it becomes important to them, right? So you don't think about any of that stuff, and then you get home and your kid, you're like, well, how am I going to get this kid into a shower? And um,
Exactly. And then you're
you
like,
know
wait,
and then I guess I can look through this novel that they sent me, that that
if you
has,
can find it.
yeah, if you can find it. And so, again, uh, such a I think untapped, or such fertile ground, I think, for improved care.
Yes. again, it's just like, what do I need to do when I get home? Who do I need to follow up with? Like you said, pain control specifically. When do I need to follow up with orthopedic specifically for this case, right?
Right.
When do I need to come back to the emergency department? What do I need to do? What do I not need to do? Those are like, yeah, and that's a lot for just someone that, just had a traumatic event, knowing
Right.
that their kiddo just broke their arm.
Correct. And if it's done, you know what I mean, in a patient specific way, right? Utilizing all the pieces of information that are there, right? So I get home and my kid is having pain after their fracture reduction. Um, a a generative AI, you know, app or bot that is able to communicate with the family can actually maybe even pull the last time that they received the pain medicine so that they get you know what I mean, so they get so that their care is informed. So yeah, like, oh yeah, your son received or your daughter received ibuprofen 6 hours ago, it's time for more. You know what I mean, as opposed to just reading this paper and them not knowing, right, when when the last pain medicine was received, what the last pain medicine was. Again, all those pieces I think of information are already out there. Do you know what I mean? It's not like
Yes,
it's a huge mystery. They just need to be harnessed the right way and then
correct.
repackaged so that patients get more personalized care and ultimately better care.
Speaking of LLMs and generative AI, patients really trying to understand things. So, do you think that that potentially could help with the 21st Century Cures Act and patients understanding and things being released to them in real time, their imaging reports and potentially their physician notes?
The answer is yes. I think that again, translating the amount of words and
We might use
the
medical jargon.
complex jargon that may be in a physician note, I think can be daunting to families. And we have to understand again that we need to do a lot to meet patients where they are, right? There are language barriers, there may be some education, there are definitely educational differences, and you know without addressing them specifically, by treating all patients the same, you actually can end up exacerbating disparities in care, right? And so I think that again, a huge role, a potential, fertile ground for improvement is using like an LLM, large language model translator, right? Something that takes into account the family's, either reading level, language, things like that, and is able to translate down what's going on in their medical record to meet them where they are. I think again, I think just a fascinating area where we can it empowers families, lets them form. I keep on using the word therapeutic alliance, but form that therapeutic alliance with their healthcare team.
Well, thank you, Dr. Mody. I really appreciate it. It was great speaking with you today. Thank you for sharing all your wisdom and knowledge with us. We really appreciate it. And thank you to our audience. If you would love to learn more about Vital, our patient experience platform, please go to vital.io. And until next time, thank you so much to all of our healthcare workers, our clinicians, our fellow EM folks in this world. Keep doing amazing things. We know and we appreciate you. We see you and we appreciate you.